Oh yes, the late POD study was presented this year at the Lugano International Conference and relies on the fact that we previously reported that patients with early POD, meaning those patients with mantle cell lymphoma that have a first relapse within the 24 months from the time of diagnosis, did very poorly, but did better with Ibrutinib therapy as compared with the chemoimmunotherapy. With this international study, it's a retrospective study, we involved several European countries to gather many patients with late POD, defined as relapsed, first relapse after 24 months from diagnosis. This background is based on the fact that there's a paucity of large-scale treatment data in this particular population. So we gathered 385 patients, and we, after analyzing with the sample size calculation the impact that Ibrutinib would have had on progression-free survival of these patients, in the end we came out with demonstrating that the PFS curve was significantly better in favor of Ibrutinib as compared to any other chemoimmunotherapy, also in this population of late relapsing patients, as we had demonstrated with the MANTLE-FIRST study in early POD patients. I also have to add that the R-BAC regimen, which is the association of Rituximab, Bendamustine, and Cytarabine, was also associated with the favorable PFS and overall survival that were comparable to what we observed with Ibrutinib. So the conclusion of the study was that definitely we demonstrated with the late POD study that Ibrutinib should be the standard choice for patients with mantle cell lymphoma in first relapse, even when the relapse occurs later in the course of the disease.